Slideshow, Breastfeeding Hints and Hurdles. 1. Breastfeeding, setting up for success. Breastfeeding has many health benefits for you and your baby, and it's a special bonding time. It does take a bit of know-how, so you may have lots of questions. Don't worry if your first experience is less than perfect. A lactation consultant, and these tips, can answer some of the most common breastfeeding how-to questions. 2. Breastfeeding ABCs. Awareness, breastfeed whenever your baby seems hungry. Watch for hunger signs like sucking noises, hands moving toward mouth, or the baby turning toward your breast. Crying is considered a late sign. Be patient, babies usually feed for 10 to 20 minutes on each breast. Comfort, prop up your feet, support your arms and head with pillows. 3. Soothing sore nipples. Your nipples may be a little sore at first. To soothe sore nipples, use warm moist compresses, and rub a bit of fresh breast milk on your nipples and let it air dry. Or dab on a bit of lanolin or all-purpose nipple ointment made for breastfeeding. A little pain and tenderness is normal. Soreness usually goes away once you find a good breastfeeding position and your baby latches on comfortably. Be sure to see your doctor if soreness increases or lasts several weeks, sooner if your breast is swollen, red, or you have fever or body aches. 4. How often will your baby nurse? Newborns should nurse every 2 to 3 hours, according to the American Academy of Pediatrics. That's 8 to 12 times in 24 hours. And sometimes a baby may nurse even more frequently. Your little one may feed from both breasts during one nursing session. And you can switch from side to side. Your baby is full when sucking has slowed or he turns away. After the first month, feedings may start moving back to 7 to 9 times a day. 5. Should you wake baby to nurse? Yes, in the first weeks. Newborns need to nurse about 8 times a day, with no more than 4 hours between feedings. To help your baby wake up, try removing blankets, changing the baby's diaper, massaging the baby softly, or placing your little one against your skin. 6. Should you use both breasts? After breastfeeding for a few weeks, start letting your baby drain one breast before switching to the other. The reason? There are 2 types of milk during each feeding, the thinner, thirst-quenching fore milk, followed by the creamier, fat-rich hind milk. Your baby needs both. If your baby finishes only the first breast during a feeding, offer the other breast at the next feeding. 7. What's nipple confusion? Nipple confusion occurs when a baby is bottle-fed too soon, and then forgets how to nurse on mom's nipple. It's not very common, but you can easily avoid it. If you're planning on introducing a bottle, wait until your baby is close to 4 weeks old. And try to avoid use of a pacifier. But don't wait too long after that to introduce a bottle or you may have trouble getting the baby to accept one. 8. Is baby drinking enough? So long as your baby is gaining about a pound a month, nursing every 2 to 3 hours, and has about 6 to 8 wet diapers a day, you can feel sure your little one's eating all she needs. Good news, by the 2nd month, some babies no longer need night feedings, and may even sleep through the night. 9. Are you suddenly nursing more? Babies have growth spurts when you may feel like you are nursing 24/7. Don't worry, not only will your body produce more milk, but these super hungry periods are temporary. Growth spurts usually hit around the baby's 2nd week, then again at 2, 4, and 6 months. More good news, most babies are ready to try solid food between 4 and 6 months. 10. Does your diet affect your baby? What you eat affects your breast milk, but usually not as much as most new moms think. Generally you can eat and drink what you like, so long as you're going for a healthy, balanced diet. But steer clear of very spicy or gas-producing foods. And watch for any allergy symptoms in your baby, which should appear in the first 4 to 6 weeks. If you're unsure, talk to your baby's doctor. 11. Can you smoke or drink and breastfeed? It's best not to do either. Smoking exposes your baby to nicotine and other toxic chemicals. It can also decrease your milk supply. It's been shown to raise the risk of SIDS and respiratory allergies. If you need help quitting, talk to your doctor. Alcohol can pass through breast milk, too. that can affect your baby's development. While the American Academy of Pediatrics says an occasional beer or glass of wine is okay, wait at least 2 hours before nursing. If you do drink, current guidelines say to limit the amount of alcohol consumed in 24 hours to no more than 2 beers, 4 ounces of wine, or 2 ounces of spirits. 12. Bonding without breastfeeding. Breastfeeding is just one way to bond with your baby. The connection between parent and child grows every time you hold and cuddle your infant, each time you talk and sing to him, and with every bath and playtime.